Why did you initiate this report, and what has this report discovered? Just a summary, and then we'll go into the details.
Okay. Good morning once again. Due to the pandemic of COVID-19 as end of the year of 2019, so we come in conclusion with the community members of what is happening, the kind of life we are suffering during the pandemic. So we come in conclusion to let's explore to the community and take their voices. What is happening? Let's see. So we went to the community members in search of the information on COVID-19, on how it is. There is a program we did on Corona Diaries. We call it Corona Diaries. They gave information on what is happening to them about health, about her issue. So we come in conclusion with Kappa on how we are going to gather this information for people to know what is going on. Then we have a statistic on the ratio of health sector. Yes, and it's much. We have much.
Actually, it's a lot. As you can see, it's a full booklet. The whole thing is a full booklet.
Yeah.
But what I'd like to look at now, the report is titled "The Failure of Commercialized Healthcare in Nigeria During the COVID-19 Pandemic." Also looks like discrimination and inequality in the enjoyment of the right to health. And some of the issues pointed out here when I look through
there is difference between the poor and the rich. In terms of health, how they get their treatment, how they look after them. Because the slums, we are the one, we are not enjoying the health infrastructure.
Are you a health worker?
Yeah.
So, why then, as a health worker, I know that this is Dr. Emmanuel, I'm coming to you. As a health worker, why I should be asking you why you discriminate against Nigerian citizens? You're the ones who provide the health care.
Yes, but we have lack of infrastructure. We have to get materials before we work. So when there is no materials, the work is not going to be more effective. Yeah.
Now, I'm coming to Dr. Emmanuel now. Let's look at the private healthcare sector in Nigeria. Your report here looks like at a trend that we see that there's currently, I'm quoting here, as a result of commercialization trends, there is currently a large and growing private healthcare sector in Nigeria. Why is this a concern? In truth, certainly we have more private healthcare facilities in Nigeria than government provided. Why is this a concern in your report?
Well, thank you very much. It's a serious concern. Because number one, government failed to do what they're supposed to do. As a medical practitioner, frankly speaking, we know what is going on in the system. We know what is going on in the system, whereby a patient will come to the hospital, and if those facilities that are supposed to be available in public health sector was not made available, definitely the health worker or a doctor, a nurse, they have their own private clinic. So they have to send the patient to their private clinic in order for them to get the facility in their own personal hospital. And they are getting more patients, they are getting more money. And that is why you can see the rate of private hospital everywhere in Nigeria is much more than government hospital because lack of facility.
You're a doctor.
Yes.
Do you have your own private facility?
Where? I have just a mini private clinic. Just coming up.
It's just coming. So what I want to understand here is that a problem? What the private sector has done is to identify a gap that the government appears, quote unquote, to be unable, I put unable in quotation marks, to fill.
Yes.
And the private sector comes in to fill in that gap. Is that a problem?
Well, I can say it's a problem as well.
It's a problem
if government do the right
Let's
thing,
take one after the other.
if government do the right thing and all the facilities are available, then Why? All the doctors, they will be very happy to work.
Ikilma.
And the informal slum cannot afford the rates of health health at the private sector, unlike the public sector, which is some are free. You are supposed to get free treatment, just like malaria. It's supposed to be treated free, but but in private sector is very, very high. The rates, you have to, like, in terms of the you have to spend much money in private sector, unlike the public sector.
But you do understand that the private sector, they're there to do business.
Yes.
Right? It's not they're not doing the world a favor. It's business, right? Your own clinic. You didn't open it as community service.
Yes.
Right? Dr. Emmanuel, I wanted to answer that because you appear to be on both sides. So you're advocating for affordable healthcare, but you're also in the healthcare system.
Yeah.
So you are able to tell us what's going on both ends. Yeah. So if you're opening a private facility, you're doing it first because you have the passion to help people, exactly. But secondly, you don't also want to run at a loss.
Yeah.
So how do we expect the private sector to handle this?
Well, there's a check and balance there. Anyway.
Okay. I think that is the nexus. So tell us about that check and balance that we're looking for.
Well, as a person, in my own private mini clinic, yes. I said, where I have a passion for people. Because I've been in the system, I know how it works as a Nigerian. And I know the kind of country we are, what is actually going on. Though nobody wants to do business and have a shortage or loss. But at times in the public sector, there are some services that are supposed to be available. In fact, all services are supposed to be available for the citizen, most especially those who are poor. Like we said that there are some set of people that are supposed to be treated free in hospital, like small children, pregnant women, old women, which they cannot even afford to to get to the health center. But some of them, they live in the community. Some of them does not have money for transport to come to public clinic. They rather go to that TBA. That's a traditional birth attendant that is very closer to them, or they go to chemist, or they go to the nearest private hospital. Do you understand? So that they can get the service they want. The check and balance I'm talking about is that government has a lot to do. They has a lot to do in order to help people in the community.
I hear you. Now let's talk about frameworks regulating healthcare in Nigeria. I mean, if we say that, and I think a lot of us would agree that accessing healthcare is very expensive in Nigeria, quite expensive, depending on where you go to, again, depending on where you live. Okay, Lagos might be more expensive than other states, and Lagos is even relative, depending on where you live in Lagos. Because healthcare in Ikoyi, in VI, it's different
from Munshi,
yes. And Bariga and Ikpaja, right? Shomolu, right? So now, are there policies that guide pricing in the healthcare sector? Are there policies, are there laws that government has made to regulate how hospitals charge? Again, I'm asking this with a pinch of salt because they're in business, but is it even advisable to regulate their pricing? Ikilma.
Okay. For the public sector, I think we have law, and we have, yes, that are governed on the prices. But for the private sector, we don't have, because they are into big business. They want to make profits. Yes.
So the National Health Act talks about a health institution having certificate of standard before it can even offer health services.
Yes.
Aside that, I don't see any other thing. Some states have developed some monitoring and regulation mechanisms to monitor what these hospitals do, but most of the monitoring go around quality of service. I don't see anything around pricing, which is what I'm saying. Is it even advisable to say we want to regulate, as a doctor, I mean, is it possible? Do you think there's a possibility to say, let's regulate private healthcare providers in terms of their pricing, of course, and quality?
It's possible.
It's possible.
You need to move closer to your mic. It's your fault.
It's possible. It's possible.
So how would we do this? Are we going to say, oh yeah, for malaria, don't charge anything more than this? I mean, how do we do that?
Where with the civil society have a lot of work to do, because it can't be government alone or individual. So we are all in it. So it's possible, maybe in the public sector, maybe they are charging 1,000 naira or 500 naira for malaria, or 2,000 naira. Probably if you come to the clinic and you were diagnosed for malaria, the normal thing they're supposed to do, okay, they write a drug for you. If the drug is not available in the pharmacies, they will write for you to go and get it outside. Whereas government is supposed to provide those drugs. They're supposed to be available
at all times.
But in private hospital, they bought all these things.
Yeah.
So what can happen is that maybe if government charge 500 naira, the private hospital, they can charge 1,000 naira or 700 naira. So it's affordable. It's affordable. 700 naira or 1,000 naira is affordable. Yes.
Now, let's before I go take some calls, there's a part of this report that really caught my attention. It looks at the privatization and commercialization of healthcare since independence. In fact, it gives us a breakdown. Please take a moment to listen to this. This report says that before 1984, healthcare services in Nigeria were predominantly financed, delivered, and governed by the public sector. After Nigeria's independence declared in 1960, goes on, with growing numbers of medical practitioners and hospital beds, public health care services rapidly expanded. But in 1984, medical treatment was free for those under 18. I never enjoyed that. Until 1984, medical treatment was free for those under 18 as well as for government workers and their families. But the system was not without challenges. There were concentration of medical services in urban areas and neglect of rural areas. But from 1984, the public health sector, according to this report, experienced a crisis because of financial crisis across the country. Nigeria started experiencing shortages of drugs, reagents, and personnel. Now, in the middle of this financial crisis, the government introduced social cuts, including cutting the health budget, which was compensated for by introducing user fees as government-run hospitals, including also as part of structural adjustment programs as required by the World Bank and IMF and so on. It also goes on to talk about the crisis in, what do we call this now? In this insurance, healthcare insurance, the NHIS. Ikilma, I'll let you talk about that part. NHIS. This report appears to think that NHIS is not as useful as it should be.
Yes, it's not. Because we are paying, it's just like you are paying to cover your health budget, insurance. But now, in the public sector, they are no more using the system. It's there, but they are not using it.
You mean the NHIS?
Yes, the NHIS. National
Health Insurance Scheme.
Yes, it's there, you pay. But due to unavailability of the infrastructures, the equipment, when you paid, I think you didn't even get the services that you paid for. You didn't get the services that you paid for. So in the private sector, I think they even bring it to them for easy accessing of health. Yes, we have NHIS. We have
HMOs.
Yes, we have a HMO. Thank you very much. So we have them now in private sector so that they can access health very affordable to them. Unlike the public sector that we pay, but due to the lack of infrastructures and other treatment, so they were unable to use what they have now.
Let me go on to, there's one part of this report I need to touch on again, but I'll open up the phone lines for a bit so that our audience can participate. 0700 993 993 993. Female callers 01 4657 190. If you're on Facebook, you can also leave your comment as well as on YouTube. If you are on Twitter, make use of the hashtag NigeriaInfoMCF. WhatsApp is 08095975805. You can touch us, you can reach us on all of these platforms. I'm on Twitter now, where Orange Chef Cap, that's your name. You said on the privatized healthcare, even the doctors do deliberately refer patients to their own personal hospital, and when the case now becomes too serious, they then refer the patients back to the general hospitals. Do you agree?
Yes.
No, I totally the healthcare agree. Persons in my studio agree that you are correct. I'm on the phone lines. Good morning. Hello. Hello, are you there? Hello? Okay, I cannot hear you. Please call again. Good morning. Hello? I can't hear you either. Let's give it a minute. I can't hear you. Hello, good morning. Why? Okay, I can't hear you either. So please try again if you can. In the meantime, I'll go to WhatsApp and take a few of your comments. WhatsApp is 08095975805. Give me a minute to also refresh that one. Good morning. Hello.
Hello, good morning.
Yeah, welcome to the show. What's your name?
My name is Shola. Calling from Ocean.
Okay, please go on.
Is it the view of doctors referring to patients to their private hospital?
Yeah.
Has been known for decades, and it is still going on. That's number one. Then number two, I don't think it is possible for a specific amount to be charged for a particular illness, because the drugs cost, like take malaria, which is a common ailment, for instance. There are some drugs you use to treat malaria that can cost 500 naira on the counter. There are some that will cost 1,500. There are some that will even cost higher. So some patients depend on how deep their pocket is. May be able to afford the highest drug. Some, depending on how deep their pocket is, may not be able to afford. So I think it is a little bit difficult to specify that this is the amount that will be taken for a specific illness.
Thank you very much for calling. I'm on WhatsApp where Piro from Ikeja says even the government, let's put it this way, even the government or public health sector is not free. Some things are free, but medications and some vital segments are paid for or bought by the patient. Good morning. Hello.
Hello, good morning.
Thank you for calling.
My name is Ayodeji. I'm calling from Owe.
Please go on.
Okay. The issue of NHIS.
Yeah.
There's a lot of problem in that system. Hospital will waste a lot of resources to treat patients. For you to recoup your money back, like for example, now we are in March now. You will just be seeing the alert of July last year payments.
Huh?
The bill you have submitted for long, they will just be paying you now. So it's difficult for the hospital also to provide every necessary thing if you are under NHIS. So
why are the hospitals not then asking for the monies to be paid in advance?
You ask for your money. They don't pay in advance. It's only the companies that the patients work for. They pay the HMO.
Yeah, exactly. Because the companies
they don't pay the hospital in good time.
So what I'm asking is, you appear to be someone who works in the hospital, right?
Yes.
So what I'm saying is, individuals as well as companies pay the HMOs in advance. Why are the hospitals not insisting on getting payment also in advance? Looks like you guys are you like the situation.
All the HMOs in Nigeria, none of them pays in advance.
I've heard you. I'm saying, why are you not insisting that they pay in advance?
If you insist, they will tell you that is how insurance work. It's after you have made the treatment and send your bill. That is when you'll be able to claim what you have spent. And that's what you have spent now will take eternity before it comes back to you. And even somebody called you now was saying that malaria drugs, some cost 300, some cost 500, some cost 1,000. So there are some patients you use drug of 500 naira for. By the time the HMO will pay, they pay you 300 naira.
All right, thank you very much. I need to go out on a break. I see your calls coming in. Please hold on if you can. I'll be right back. We're looking at the commercialization of the healthcare sector in Nigeria. Is the government deliberately doing this? Let's talk some more when I return. My name is Wemimo Adewuni. Don't go away.
Everyone is proud of the doctor I've become. I'm grateful.
Believe that a drink could help you ginger your swagger, or should I say swagger your ginger? Well, believe it or not, the distinct blend of Good Life Zobo Ginger, made from the real taste of Zobo herbs and ginger plants, was made to stand out just like you. But here's what makes it unique. It is the spice that keeps you on track, gingered and revived as you dare to be you. Good Life Zobo Ginger is stacked with the rich goodness of vitamin C to keep you nourished and refreshed all day long. It is the complete meal in a bottle on the days that you cannot stop for a meal. And the best part is you don't have to break your fitness goals, because Good Life Zobo Ginger is naturally flavored, healthy, and contains real Zobo, ginger, and vitamin C with a distinct blend of refreshing taste. So next time you need a ginger to dream, or rather the ginger to dream and dare to be you, reach for Good Life in a bottle and savor the refreshing taste of real Zobo and ginger. Drink Good Life Zobo Ginger and enjoy the taste of a good life. Do you know that through artificial intelligence it is possible to overcome financial challenges now? Using your phone, the
99.3 Nigeria Info. We are more than just radio.
profit return every single month without you doing nothing but a robot.
Have deliberately pushed the healthcare sector in this direction. Let's look at this part now. This report is very, very comprehensive. By the way, is it available online, Dr. Manu?
Yes, it should be available online.
Yes.
Where can they find it? They want to read it. You'll get me the details, yeah?
Yes, I'll give you the
Okay,
details.
now this report looks at also the private health sector, describes the growing health sector, and also points out fingers at the NHIs, like I said before the break. Now, according to the National Strategic Health Development Plan, that's a 2018 to the 2022 plan, it specifies that Nigeria has a growing private health sector which provides 60% of the healthcare services through 30% of the country's conventional health facilities. Wow. That's quite a number. A survey that the WHO also carried out last year, 2021, shows that 52% of the population in Nigeria uses the private sector for outcare patients, which is the highest proportion in Africa. Is the highest in Africa. Yes. The Ministry of Health data on hospitals and clinics also shows that private actors are particularly present in secondary care. In secondary care, they account for 78.8% of all hospitals and clinics. In primary care, however, they represent 18%, and at the tertiary level, 36%. Now, what's the role the government has played in this regard? This report points fingers at regulatory frameworks that the government had created. Please tell me more about this, Ikilma. How has the government fund the growth of the private healthcare sector? Do you think there's a deliberate, maybe a mistake, or has the government done anything specifically to enhance the growth of the private healthcare sector in Nigeria?
I would say no. Yeah, no. Like, you mean they have hand in their growth of...
Yeah, do we have policies that have encouraged the growth of the private health sector?
No, we don't have.
And is the blame on the government on this one, on this the growth of the private sector? Is a blame for the government?
Yes.
How?
Because they didn't provide the well equipped infrastructures for the public sector to use.
So is there a possibility that the government can shoulder the burden of healthcare in Nigeria? Do you think it's possible?
No, it's not possible for them to be shouldered.
Mm-hmm.
Even we individual, I think some need to be shouldered on us.
On the citizens?
No. Come again?
I'm asking you if you think that the federal government can take the burden of healthcare in Nigeria so that we can possibly phase out the private sector. Do you think that's possible, or to drastically reduce the number of private hospitals we have? Can the government do it?
Yes. They can reduce the high rates of the public sector. They can reduce it.
Of the private sector?
Yes, they can reduce.
How could this be possible?
Will they build equipment and more facilities? Because some, they don't have nearby public facility to go. That's why they are using the private sector. Just like what Dr. Taiwo said. He said some cannot afford the transportation. That's why they use the chemist or nearby private clinic. So when we have more of public facilities around, I think they can reduce, but well equipped. Not just to have the facility, but it's not well equipped. I think we can reduce.
Dr. Taiwo, what do you think? What do you think about this?
Well, I want to cite an example.
Okay.
Just like a public school and private school.
Yeah.
In a public school, I attended public school. In GSS 1A, we have about 88 students in one class. Look at the population. Then when you go to private school, maybe in GSS 1 or GSS 1B, there might be 20.
Yeah.
Just 20. Because
or 18 or 15.
Or 18 or 15. So if government set a policy guiding the private sector, and they provide more clinic that is accessible, affordable, with facility. In fact, people will no longer go to private hospital. They will be going to public hospital, because whatever they went there to get, they will get it. Very sure.
Is the government doing anything wrong by not providing these facilities you've talked about? Remember, the right to health is not justiciable in the Constitution.
Yes.
Good news, in the current constitutional amendment, now the right to education, basic education, will become justiciable, but health is not. So, I mean, going on that line, is the government doing anything wrong if they say, well, we can't take the burden for healthcare, so we're just going to allow the private sector to do it?
It's very wrong. It's very, very wrong, because government has to do something. Look at the global world. In other countries, it's not like this. So there are policies that everybody is entitled to free health. It's like that in other countries, but here in Nigeria, in the constitution, there are provision of law that talks about access to health, our right to health, which they sweep that constitution under the carpet. They are not even talking anything about it. So that is why you see, if you sick, you are on your own. And some of them, they fly abroad, they go and have medical care in abroad. They don't care about the citizen. If anything happens to you, you are on your own. So
you're on your own. 0700 993 993 993. Female callers 014657190. Good morning. Hello.
Hello. Yeah. Good morning.
Thank you for calling.
Yeah. This is Udo Idong Estate, calling from Ushudi.
Yes, please go ahead. Please go on.
Yes, I just want to comment on some things I'm hearing on the radio.
Yeah, please go on. Please go on.
Yes, I don't know the amount of research or investigation that has been done by the resource people in your studio, but I'm not very comfortable with some of the things that I said. Number one, that for people that are covered under managed care, that they don't get what they pay for. That is not true. To start with, I'm also a stakeholder in the industry. I work for a private provider, and we also service NHIS enrollees. And I can tell you that it gets what they pay for.
At the government hospitals or at the private hospitals?
No, it's a private hospital, please. Okay. That's a private hospital. And I can tell you that even NHIS would not take it lightly with any provider in Nigeria. Let me say in Lagos. At least that is where the industry, the spare that I'm familiar with, will not take it lightly with any provider that does not provide the service that he or she has received capitation or fee-for-service rates to provide.
Let me ask you about, since you are still here, I like that you're a healthcare HMO provider, so to speak. Now,
no, healthcare. I actually work with the hospital, not HMO.
Oh, with the hospital. Can you tell us if in the government hospitals? I know that NHIS is federal government, right?
Yes.
Do you know if people also make use of the NHIS in public facilities?
In government hospitals, yes, of course.
They do. All right. Thank you very much for calling.
It is the same regulatory role that NHIS plays on even all the providers, including government-owned hospitals.
All right. Many thanks for calling. Let's speak to someone else. Good morning. Hello.
Good morning.
Thank you for calling.
Yes, thank you.
Finally, a woman makes it through.
Yes, I'm sorry. I could not get the female line.
Okay, that's fine. I think it's not even working because I think there's an issue with it. Please go on.
All right. I think one of the major problems that the NHIS is facing and why providers don't get their bills paid on time is because it's going to be very difficult for them to pay capitations to the hospitals because even the service providers are not trustworthy. If the NHIS pay them ahead of time before those bills are incurred, Nigerians will come up with all sorts of bills that were not even incurred. So it's going to be difficult to vet those bills and ensure that the claims go to the appropriate channels because providers that you pay about, let's say, for example, you give them about 50 million that, okay, we'll be sending traffic about 1,000 people to the hospital. And then you come in saying about 500 of them had appendix surgery done. How? There are people from all over the country that uses the service.
Yeah.
So it's going to be a challenge. They could have fought for it, but because even the bills that have incurred and, it still goes through claims before bills are being paid, we still find out that some of those bills are fraudulent.
Whoa.
So it's just a Nigerian thing. I don't think the NHIS is quite slow in terms of their process and services. That's why the bills don't come on time. And because most of those bills need to be vet. You can't just pay claims because the hospital, somebody in Niger State came in and did a very rare surgery that even then don't have the capability to do. But because that money is in their custody, they are going to just go into the bills, and at the end of the month, you can't request for a refund, even if you do, or you send your lawyers to try and go and audit them. It's going to be a long thing.
I agree.
To get those funds back.
I totally agree, and I think I agree with you that that's one of the biggest issues we're facing, in providing care, especially managed care. HMOs, NHIS, that balance of trust in. Can I trust you that the health care you said you would provide for these patients is what you're providing,
yes.
Right? And the ones you say you've provided, is that what you truly provided?
Truly is provided.
Right.
Yeah.
Good morning. Hello.
Yeah. Good morning. My name is Tunde, first time caller.
Thank you for being here.
Yeah, I'm also a stakeholder.
Okay.
I can tell you from experience that NHIS in the private sector work very well. But the issue is there's always a limit. If a client access facility, NHIS has faced, they don't know that they have a limit. Sometimes they will offer service that is even more than their limit. So they are asked to pay more money for that. So what some of them doesn't know, they don't let them understand their limit at the point before they access that facility. I think that's one of the problems. So they need to be educated. They need to be aware of their limits before they even approach the hospital.
So they can understand the scope of what their rights are, so that you're not even claiming more than what you're due for. And there are limits actually. HMOs, I was told I wanted to change my glasses, is due. You know what I was told? My HMO limit Oh God, I actually just laughed when I heard what my HMO limit was, and I had to wait 2 years first before I could access 10,000. And I was like, really? So I'm going to wait for you people for 2 years before I can change my glasses. So certainly I wouldn't wait for that. Prince is on the line. Hello.
Hello, good morning.
Good morning. Thank you for calling.
Yes, thank you for having me too. Okay, I'm interested in the health sector.
Okay.
But as an entrepreneur.
Okay.
And this is what I think is missing. Proper regulation. So the reason we fairly have some semblance of organization in the finance sector is because we have CBN regulating activities of the banks, the microfinance banks, the payment service banks, and all of that. There is a growing process. Now, we don't have something like that in the real estate and the health sector. So the medical practitioners who own private hospitals, which I really appreciate that they are even in that space, because if they were not there, it would be much more calamitous than it is.
Absolutely.
Yeah, so that they are even there is a plus, but they're not regulated. So they run like a normal business would run. The mindset of profit and loss is what drives.
The only, well, I agree with you. In comparisons with with the banks and telcos, the difference here, like some of the callers have pointed out, is in this instance they're not just providing service; they're also providing products.
Yes.
It's both products and service. So they're delivering the things they're using for you. They have to buy them.
Yes.
So how do we regulate that? That's the problem.
Okay, so there is a benchmark price for products. Everybody knows how much paracetamol costs in the market.
Yeah.
Everybody knows how much Ampiclox costs in the market. So there's this line price. Even though we know that for imported products, price differs from imported products and than locally manufactured ones. So if you're going to buy premium drugs and premium service, then you are prepared to pay premium price. So if you're going to go to Havana Hospital, I don't call names, but if you're going to go to a private, top-notch private hospital in Ikoyi, or VI, you expect to pay some top-notch prices as well too. And if you're going to go for regular middle-class services, then you know that you're going to pay for that. So there's a benchmark price for services.
But do you also think, I'm engaging with you because I like this line of thought. The thing you are proposing is what I think is currently happening, is that the prices in, like I said earlier, in some areas are different from other areas because the cost of the service is added onto it.
Exactly.
So what difference do we want to change?
Now, what we want to change, and that change will be driven by government. So what government will be doing is we will be increasing our capacity to deliver quality, top-notch service and products in our health centers.
Yeah.
We'll also be increasing, number two, we'll be increasing number of health centers per local government, per state, per urban area, per rural area, as it were. Now, this increase in government facilities will drive down prices in the public center, in the private centers rather.
Yeah.
So it's a problem it's an economic problem.
Yeah. Demand and supply. Absolutely.
Yeah. So the moment the government plug in the loopholes in their own sectors, the private entrepreneurs would have no excuse for skyrocketing prices when ordinarily I can.
You see, I can close the show on you because, man, you've done justice to it. Thank you very much, Prince, for calling the show. Thank you. Yeah, and I wasn't joking when I said I was going to close the show because our time is actually very up. But I hope that this conversation, of course, it will continue. We'll continue to put pressure on the government to improve on services.
Yes, we are going to be tracking.
Yeah, and track what they're doing. Even the budget, no matter how small it is, track it.
Yes.
The money they said is for this. Is it used for this?
Yes.
Where does it go?
Money?
Where's the money? Where does it go? As a NGO that's called Follow the Money.
now that autonomy are being
given to the local government. Follow the money. Let's know what the money is going to. Thank you so much, Dr. Emmanuel Taiwo and Ikilma Mohammed, for being here. Nigeria, I'll see you again tomorrow morning. This evening, by the way, there's an event coming up. It used to be called Social Media Week. It's now called Africa Next. I'll be on a panel today. I hope to see you there. Let's discuss the future of African market. Can we have a one African market, the AFCFTA and all the intricacies, and how Nigeria can benefit from it? It's happening this evening. morning. You can find the details on my social media handles at Wemimo Sport. I'll see you tomorrow morning at 5. My name is Wemimo Adewuni. Have a good day.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.